Hi, good evening, everyone. Waiting for people to join. Hey, Esther. How you doing? I thought I'd start it a bit early just to get people to join in. Let's wait and see when we get more people. How are you, though? Oh, forgot. I got used to. I'm used to someone opening and then me joining, and then I can have a conversation. I forgot that I can't have a conversation with you, Esther. It's all right. Anyway, we're here. Let's hope more people are joining. Maybe you want to send a reminder in the hub and say we've started. Put in the hub first, in the WhatsApp hub, and then put it on the social media. Hopefully that helps. And people can start to join. 7 o'clock. Hey, where are the people? Oh, wait, I'm using my phone. See if I can. Hey, thanks for joining us. Hello, Moyo. Moyo Sola. Good evening. Thanks for joining us. Just waiting for a few more people. I'm not sure how much you know about FHF. We're called FHF Support Network, and we're just a charitable organization that helps create an environment to educate, support, and empower women, really. So, but we're looking for more people to join, hopefully. I hope everyone's doing well. How was your day, Moyo? If that's all right, if I can call you Moyo. Hello, Funola. Thanks for joining, for honoring us to join. We're waiting for more people to join us. Let's give it a couple of more minutes and see. Good stuff. Good stuff. Anyway, so Moyo, is this your first time here, or have you joined our previous Q&As? Do you know anything about FHF Support Network? Hello, Rosalind. Thanks for joining. So I'll just check in with Moyo if it's our first time here. Rosalind, let's know if it's your first time here or you've joined our previous Q&As with professionals. Let's hear from you. The doctor's running 2 minutes late. She just says she just finishing from her clinic. Hello, Heavy D. Thanks for joining. Good evening. Oh, okay. Welcome back then, Moyo. It's not her first time. Good evening. Thank you, everyone, for joining. Rosalind, is it your first time here? Is your first time in one of our Q&As, or you're a regular as well? Hello, good evening, everyone. Thanks for joining. Thank you for joining. So as I was saying, the doctor's running a bit late, so about 2 minutes, she says. So we're just kind of have to learn and see when she's able to join us. But in the meantime, I was trying to see if so Rosalind says it's not her first time either. Welcome back then. She's a regular. Thank you, Rosalind. Also put in the chat, honestly, how these Q&As have been beneficial to you, what you've taken away with it, how it's been helpful. That would be a good feedback for us as well, to know. And also what kind of topics you would like to us to address. But this month, because it's Women's International month, well, 2 days ago was Women's International Day, but we're making a March really about women. So that's why, hello, thank you for joining. So that's why this month we're talking about a very important topic for the older women, which is menopause, and a lot of people are not talking about it. So we thought we'll talk about it. We'll bring the professionals on to kind of answer women's questions. And if it's your first time joining, if you're a regular, welcome back. And if it's your first time of joining, we're called the FHF Support Network. And our goal is to create an environment to educate, support, and empower, nurture women, and also address conscious and unconscious biases that women face. We just want to empower women to live their fullest and their best lives, and also to encourage and educate the next generation, because so that they don't become victims of the things that we've had to go through. So thank you everyone for joining. We're waiting on the doctor. I'm hoping that she just messaged me to say she was just finishing off her clinic, and hopefully she'll join us soon. Thank you, Trevor. Thank you, Light Ups, for joining. Thank you, Pegs. Good evening. I hope everyone's had a good day today. Please put in the chat box how you're feeling. Let me know. Give me a thumbs up if it's been a lovely, good day for you. So, as I was saying earlier on, so we're a support group really basically to encourage conversation and proper solutions really around women's health, from fibroid to endometriosis, myomectomy. People, I have a few people that are mentoring who have gone through or about to go through hysterectomy, finding alternative medicine and food and lifestyle, really. Anything to help women live their very best life is what we're about, So that's why we're here. We're called the Feminine Health and Fibro Support Network, and for short, we're the FHF Support Network. Recently, we had community outreach in Lagos, we're all about creating awareness and supporting women, and just giving women a better life, and talk about the things that other people don't want to talk about, and share experiences really, because it goes a long way. Peer-to-peer mentoring and hand-holding is some of the things that we do. We have a WhatsApp hub, where people come together, mentor each other, share experiences, similar things that we might be going through, heavily recently. We've talked about fibroids a lot, but in the coming, this month, actually in April, we'll be focusing a lot on menopause. And next, at the end of April as well, we'll be doing an online thing for younger girls between the ages of 12 and 25, really, just to inform them and kind of help them, educate them on what to look out for, regarding some of these feminine health issues. Welcome, everyone. Thank you for joining us. I'm just waiting on the doctor. I haven't seen her in the room yet. She did say that she was running late from her clinic. I'm hoping she joins us soon. So as I was saying, a few days ago, we had a community outreach in Lagos, which was a good turnout, and amazing work that our on-ground team did in Lagos. It was a fantastic thing. And because it's also Women International Day recently, breaking the bias, we're all about, empowering women, encouraging women, educating women, so in that outreach, we're talking about fibroids and some of the myths and the treatments, and they're just educating the women who will not usually come on here to on social media, so go into the grassroots, if you like, to reach out, and create awareness. and some kind of support, and also was a medium for us to identify which women we can support as a charity, and but heavily this month we're going to be talking about menopause and all things that pertains to menopause, to help the older women and the older generation. So keep your questions coming. We do have a few questions that we're going to be talking to the doctor about this evening. Some women sent their questions in, so I'm just hoping that she can join us soon. Please bear with. I'm waiting on the doctor. I haven't seen her yet. And while we're here anyway, if anyone's got any question that you haven't submitted through our Google form, you can put it out here. A member of our team will pick that up, and we can at some point ask the doctor. And also regarding general menopause, we have two sessions for that. So this week is one session, and in 2 weeks time, the fortnight from today, is another session, to talk about menopause, general menopause, and then another week, I think in sometime in April, the 7th of April, also we're going to be talking about menopause and lifestyle, and the kind of food and all those kind of things. I've just seen Dr. Omar, can you request, I see you've joined, can you request to come on the chat, please? I can see you're in the room now. Please request to join the chat. Miss Omar? Bear with. Miss Omar, I see you're in the room. Can you just press the request button to join this chat so we can come on the video and everyone else can see you and we can hear you? Sorry about this, everyone. Just trying to get the doctor to... from experience, we know that most of the doctors we've had here, the issue's always been this social media thing, but bear with us, please. Miss Omar, can you hear me? If you want to call me on my phone or something. Request to join the chat, Miss Omar, so we can see you on video. I see you're in the room, but I just need you to join the conversation so I can accept. Hello, good evening, everyone. Thanks for joining. Please bear with. I'm trying to get the doctor to join the room. Join the chat. She's in the room, but I need her to request. So I've sent you an invite as well to join, whichever one you pick up first. There you go.
Hi, you all right?
Yes, we can't see you. It looks really dark. You look like you're
I'm in the car. I'm in the car.
Oh, we can't see you though. It's really dark in there. Anyway. Hi, Miss Omar. Okay.
Right.
Good evening.
You okay?
Yeah.
Good evening. Hi. I'm in the car. Yeah. It's all right. It's okay.
Okay. We still can't see you, but okay.
I'm so sorry. I was in the clinic. I just finished.
I know.
Yeah.
I absolutely appreciate your time. I know that you're
No. I love to.
But you always make time for us, and absolutely grateful for the work that you do.
No. I love to be with you. And it is the most joyful time, to be honest, when we spend with each other. And for good evening, everyone who's hearing me or seeing me. I'm in a dark a bit because I'm driving.
We can't see you.
Yeah, I know you can't see me.
Yeah, just introduce yourself a bit, Miss Omar.
Hi, I am Kazal Oma. I am a consultant gynecologist, King's College, Princess Royal University Hospital. My super specialist interest is oncology, but also I have my specialist interest in the complicated benign gynecology, especially with the fibroid and it is problem in addition of menopause and urogynecology. The menopause, basically, it is coming into light now, is very, very popular to know as well as to treat, because up to 5 years ago, there was a research, unfortunately, was done because everyone in the world started to take in HRT. From the old women, from the people, they have a lot of medical problem. So they were saying that's safe for everyone. But these people, they had a complication. So what they did a research and they said, oh, no, no, no. Now HRT is bad. Nobody have to take it. Everyone were scared. And also the HRT at that time was given, the type of the hormone was given was a horse urine. The estrogen was taken from horse urine. Yeah, and it was always was given, it was a horse urine. They were extracted the estrogen from horse urine, and that is why. And also the estrogen was very made up. I mean, the pharmaceutical made up and nothing bio-identical. Then what has happened, the companies, they made different type of HRT, which they are bio-identical. But the main important thing, who has a menopause? What does the menopause look like? Luckily, in a black community, I know God gave you a lot of fibroid, but the menopause symptom is less.
Oh, really?
Yeah, is less. Why? Because of yam. Yam have a lot of biological hormones in, which is good. Yeah. So you eat a lot of yam, and that is. And genetically, the menopause is late, and genetically, the symptom of menopause is less. So by time I see 20 white women with the menopause symptom and early, I see one black woman. One black woman. So that is also an advantage.
Awesome.
But there are two types. One of them, they call it perimenopause, and one of them is definitely menopause. Perimenopause, when the period become sporadic, every 2 months, every 3 months, then the women start having hot flush, sweating, loss of concentration, lack of energy, lack of libido, and anxious, and the husband or partner calling them, oh, this is hormonal. Or at work, everyone is like directing to the woman, oh, the women have these hormone problem.
Mood swings, yes?
Mood swings, mood swing, anxious, feeling angry, tearful, very angry with, especially in that time you have teenagers, so everything is not acceptable at that time. So it is a very menopausal, but the period may come every 2 months, every 3 months. And in the night, your husband or your partner is cold and covering himself with a duvet and blanket, and you are hot and you don't know what to do. You have been sweating, and after a while you feel cold, and after a minute you have to take everything off. So these are the things which is causing, which is unfortunately the women have to go through everything, from the menarche to heavy period to painful period to pregnancy, and then at the end you end up with a menopause symptom.
Yeah, it's interesting you talked about this perimenopause. We do have quite a number of questions today that women have sent in that we're going to be asking you. But before we should, I want to ask you one, which which is very close to home. So, for someone who's had hysterectomy,
Right,
So do
yeah.
you experience perimenopause? Because some of the symptoms that you've just said, honestly,
Yeah.
happens to me. And I'm wondering,
Yes.
why am I
Yeah.
sweaty? Why 1 minute I
Oh,
want to do
yeah.
on, 1 minute I want
Yeah.
it off.
Mm.
So I'm trying to find out,
The
is it, have I
ovary,
started?
one of the blood supply to the ovary is come part of it, like 25% is coming from the uterus. When
Right,
the uterus go, then you will have a little bit blood supply and feeding of the ovary will be less.
right.
So then the ovary start making less hormone than before, after, especially after a year or two.
Got
So
you.
then
Got
the sign of the menopause is start to appear, which is
right.
called perimenopause or menopause.
Got you.
Maybe
Got you.
not all of them there, but
Okay.
some of them will be there. So
Right.
the people have the hysterectomy, yes, that is a disadvantage, unfortunately, even if the ovary, they look very beautiful and nice and leave them. But blood supply, yeah,
If not.
75% come from your tummy,
Mhm.
25% come from the uterus, and that is going off when the womb is out.
Got you. Got you. That
Yeah,
explains that.
yeah,
Thank you very
yeah.
much. So one of
You're
the other
welcome.
questions, go on.
Yeah, yeah. No,
Yeah.
no, no. Carry on. It is with the question is nice to answer. Yeah.
Yeah, thank you. Thank you for answering that. One of
No,
the other
sorry.
questions that we've had,
Mm,
someone wanted to know, she said, are there any special things that she needs to do as she gets into menopause, as she enters menopause? She wants to know if
mm,
there's a way to prepare or any special things that she
mm,
should get
mm. The
ready or
weight
do.
is very important. The
Wait.
weight is very important.
Okay.
Yeah, and also with only, it's not about hot flush and libido and things, and the bone
Hmm.
structure is get brittle, the
Yeah.
bone become weaker.
I
So
think we have a
vitamin
question
D
around the
and
bones. Yeah.
rich food, calcium rich food and vitamin D is very, very important,
Mm-hmm.
because in menopause the osteoporosis is very common. And
Mm-hmm.
in the past, they were saying, oh my God, when the women get above 60, they have hip fracture. They just slip a little bit, they get fracture, because they
Mm.
didn't know. They didn't know they were menopausal, their bones become very, very brittle. So then
Right.
any touch or any slip, they get fracture. So
Wow.
that is one of the problems.
Okay. Oh, thank
Yeah.
you for that. That.
No,
Thank you for
yeah,
that.
so they have to be prepared. The weight is very important, not to be overweight, because they get more hot flushes, more sweating, and also if they go to any treatment, the effect of it is not going to be great.
Got you. Got you. All
Mm,
right. Thank you
mm,
for that. So,
mm,
which brings me to the other question, because I know you
mm,
said something around because the brittleness of the bones that you need
mm,
vitamin C.
mm.
This
Yeah.
question says, do I need extra supplements, or diet change as I get into menopause?
It is, as I said, the rich food diet, a rich calcium food diet, as
Mm.
well as if someone want not to have HRT,
Yeah.
we have soya bean, soya sauce, soya milk, and yam is giving a bit of natural estrogen to the body.
Wow.
That is
Okay.
what you
So,
need. So
yam,
that, yeah,
soybeans. Yeah.
yam, soya bean, soya sauce, soya milk is have a rich estrogen, natural estrogen in.
Right. Interesting.
Yeah.
Because it's amazing that before you get to menopause, these are the things that you want to avoid, especially soya. If you have
Yeah, for
fibroids
the
like this, these
fibroids
are the
and things.
things
So
you
we
want to
have a
avoid.
clash.
But,
Yeah,
but
we have
all
a
of a sudden,
clash
as
with
soon as
that.
you get to
Yeah,
menopause, you want
yeah,
to be able to eat these things. Interesting.
yes, yeah, yeah.
Hmm.
And also the clothes is very important, especially when in Nigeria is a hot country. You
Mm-hmm.
have to have as much as possible not wearing dark clothes.
Oh,
Always a light, white, and bright clothes, because it reflects the sun, and hot
light,
flush and
bright.
sweating will
Mm-hmm.
be less. And anyone in this country should
Mm-hmm.
always wear layering, not a
Mm.
thick woolly jumper, because thick woolly jumper make you really hot and you can't take it off. So the best thing to put layering. When you are hot, just take them off. When you are cold, then put it on. And diet, spicy food is not for menopausal women.
Oh, no spicy food, yeah?
No spicy food, as well as no hot bath too much. Hot shower is cool shower. Cool shower is good. And never do hot shower just before you go to bed. You get lack of sleep because the hot flush and sweating will be more.
Got you.
So
Got you.
cold shower, less spicy food. These are a natural thing you have to adopt.
Oh,
And
wow.
yeah, these are a natural thing. And also an addition, then when it become, we call the women is that is 100% menopause, when they stop their period for no reason for a year. 12 months no period, we call them menopause. If they don't have
So it has to be
hysterectomy
12
or
straight
anything.
months. It has to be 12 straight months of no period for you to say that you are in menopause, yeah?
Yeah.
Interesting. Okay, and
But
also I spoke
perimenopause start before. It start before.
Got you.
Perimenopause start before. But they still have a chance to take the HRT. And HRT, as I said, is not bad. Is natural. Is more natural. Is more bioidentical. So if it's not like to be fearful, especially for 5 years, is good. And the other thing which is a problem with the menopause, the function of the bladder.
Okay.
Yeah, dry vagina and tightness. The vagina become more tighter because it become too dry and too painful intercourse. And also the bladder become, and the bladder become more irritable, more weak, going to the toilet more frequently because there is no estrogen around the area.
Wow.
Yeah. So the women,
Got you.
and lack of libido. Lack is a peak of the time when the children grown up. You have your time, and then you have a lack of libido, which is unfair.
Bad timing.
Bad timing. And the husband is going to be on the peak of their libido. So that is the main problem is happen between husband and wife.
Oh, because I'm sure that the husband's been looking forward to when the children can leave home, and now children leave
Yes.
home, the wife has got issues.
And
Oh wow.
yes, and then you just want to go to bed. You just want to sleep.
I know.
Yeah.
So this other question, well, I think you've talked about it a bit. It's around the bones. She said, I have read that changes could affect bones and body. What do I need to stay strong and healthy? So, which I think you've talked about some of the food that's good to eat, which is the yam, the soybeans, the soy sauce, and also supplements in vitamin D, food that's rich in calcium. So those are some of the things. Also, this person wanted to know, what can I do to improve mood swings during menopause?
I think the main thing about mood swings is HRT, unfortunately, is taking hormones.
Really?
Yeah. It does affect, because unfortunately the other option that the GP will give you antidepressant, which you don't need antidepressant. You don't need, and you will not get benefit from it. But if you have the HRT, you are more energetic, you are more bright, less anxious, less tearful, and then you are going to be very well. And it has type. You can start with a mild one. You can start. There are too many type, and it's very, very good. It's very, very good. So at least for 5 years, you should not be making yourself miserable. Yeah, it is miserable life. It is a miserable life, and it is
No,
not
I
fair.
guess just find things that make you happy, find fun things to do, discover new things,
The other
be
thing, as you say,
adventurous,
make yourself busy. Make yourself busy, which is
find new
important because
interests. Yeah,
yeah, find an
find
interest.
new interest.
Yeah, I
Mm-hmm,
have a
mm-hmm,
patient, I have a woman. She had a bit of childhood problem, and then she managed to get her way from age of 16, work, married, a lovely family, 2 children. She
mm-hmm,
continuously was busy with the children, taking them to school, doing extra things for them. Now the
mm-hmm.
children, they both teenager, they don't need her for everything, apart from coming home and the food ready, nothing else. So now she feel empty and menopause, making her just sitting and crying. And
Oh, not
she
even
said, I
funny.
don't know what to do. I said, go and
I know.
volunteer. Go and volunteer.
Yeah, keep busy.
Yeah,
Honestly, I get you.
yeah,
Be
yeah,
busy. I mean, travel the
yeah.
world. Do fun things. Honestly,
Yeah, no,
find
just go
adventures.
out. Just go out from the house.
Find
Because
adventures.
if you stay where you are every day in the morning,
You'll be
waking up with the
miserable.
same situation, go and
Mm-hmm.
do volunteer work. Just surround your house, around your street. You can find something. Slowly,
Mm-hmm.
slowly, you learn, and slowly, slowly, you can apply for a job.
Mm. Yeah,
Yeah,
yeah.
so that is
Okay.
the most important thing. You
Mm-hmm.
have to be careful that not to be lonely and alone. uh,
Mm-hmm.
think about it. If you have your young children, you have to look after them.
Mm.
Still spend some time to learn something in the future when they gone and they don't need you to use it.
Absolutely.
Yeah,
Absolutely. Get
it is
busy.
also used for, to be honest, it is very good for dementia and Alzheimer and all those things,
Okay.
because unfortunately the lack of hormone can cause dementia.
Wow. Okay.
Yeah,
Hmm.
yeah,
That's.
and it's also protect bowel. If you
Mm.
have good hormone in the body, it protect your bowel from bowel cancer. So it's not only one thing; it is many, many things.
Yeah. So
Many,
before.
many things.
So someone wanted to know what the full meaning of HRT is, which is hormone replacement therapy. But I wanted to
Yeah.
ask you something around that.
Mm,
Because when we started, you did talk about people trying to get away from using HRT, but
yeah.
now you're also kind of recommending it. So I'm just trying to find a balance here.
Mm. The difference is before they give it to everyone.
Right.
70-year-old having her heart was halfly working, diabetes, hypertension, not
Oh.
controlled, nothing. They were giving it to them 70, 80-year-old, which is really realistically not.
Hmm.
But now we are selective,
Got you.
and we know, and that time it was, as I said, it was not natural, it was synthetic. But
Okay.
now the hormone replacement therapy is more or less, it is body bioidentical. So
Okay.
what your body was producing at age of 30 is similar you taking now. So that
Right.
is what is the difference. So that is why we
Okay.
encouraging people to take it.
Okay, so it's not
Yeah.
synthetic anymore, and then you
No.
do like there's a screening for who gets it and whatnot now.
Yeah.
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 Okay.
Yeah.
All
Yeah.
right. Thank you for clarifying that. Also,
Yeah.
someone
That's
wanted
the
to know
difference.
about I
Mm.
didn't quite get this question. What about people who take birth pills and their period stops permanently? Oh, I guess it's trying to
They,
ask if someone who's been
mm,
on birth pill, who's been on like pills and now,
contraception.
yeah, contraception, and then their period stops.
Yeah, but
I,
how old they are?
okay, I'm not sure. She just put that in the
Yeah.
chat. Um,
If she's young and she was on a contraceptive pill for a long time, and then when
mhm,
she stopped, the period stopped,
mhm.
it means that there is other problem. If she is, for example, I have a woman, they come in, they just carried on a birth pill till age of 50. but they didn't know that they've been menopausal. So when they stop, then they get menopause and menopause symptom. They may be, if they haven't taken it, they would be in menopause before that. But because they were taking the pill, they didn't know. So that is a difference.
But if they're younger, maybe if they're in their 40s or mid-40s and the period stop, so is there something else to worry about? Is that what you're saying?
Stop. Yeah. They have to be investigated why the period stopped for something.
Okay.
Yeah. Mm. So
all right. Thank you for that, Musoma.
No
Someone's also
problem.
asking. Go on.
Yeah. Carry on.
Did you want to say something? Go on.
No.
Okay.
The question
someone also
is
wanted
quite
to
good.
know, does HRT? So someone wanted to know if HRT has side effects.
Of course, there is nothing without side effect. People take pill 15 years and they know what is the side effect of it. But HRT, the difference between the women, if we have 1,000 women not taking HRT at all, and the 1,000 women they taking HRT, the 1,000 who is not taking HRT, 15 of them still have a breast cancer. 15 of those women, they still have a breast cancer. In the HRT group, it become 19 of them. So only 5 in 1,000 increase the risk, which is people worry about it. But that is very little, very, very little.
Because even in the sample of people who haven't had it, they still
have 1 in 12 they get cancer. So it is still in. If people have genetically very strong genetic problem for having a breast cancer, that is where we don't like to give it to them. If the mom, grandmother, aunties, lots of family members have colon, breast cancer, prostatic cancer, if it is too strong, then we are a little bit reluctant to give it to them.
Right.
Yeah. But in the general population, to be honest, the risk is minimal. And the other thing, when they take it, maybe for 4 to 6 months they have odd bleeding, just a little bleeds there, or sometime maybe like a heavy period. But all that will settle. They will settle.
Right.
Yeah.
Okay. All right. Thank you for that. Ms. Huma. Another question. Same person wanted to know if you've entered menopause for a few years, can you still get HRT? So I reckon.
Oh yeah. You can take it up to age of 70, even if you have not taken it before.
Okay.
We prefer it to start from 50. And before. Yeah, up to age of 60 is 100% safer, but you can take it still if you haven't taken it before.
Right.
Yeah.
Got you.
Yeah.
All right. Thank you, Mr. Ma. It's really been very educative and interesting this evening. I've got a few more questions and we still have a bit of time, so let's keep going. So, I think you talked about on this a bit earlier on. Why women have sexual problems during menopause, So.
Oh yeah, because the estrogen give you the libido, give you the relaxing of the perineum of the vagina, moisture of the vagina. That is all the from the estrogen. But if someone doesn't want to take tablet or patch or something, there is a cream.
Okay.
There is a cream alone or tablet they use it vaginally, which help out for the moisture of the vagina and increase a little bit of libido.
Interesting, because the next question was somebody say to recommend something for vaginal dryness. So you say there's a cream.
Yeah. There is a cream, there is a tablet.
Okay.
The vaginal pessary. pastry. You can put twice a week or a cream twice a week and make it less drier and more moisture and help for intercourse much better.
So these are things just over the counter.
No, it has to be prescribed by the doctor.
Right, got you.
The one
Oh,
which
okay.
is the one which is over the counter is a water base, have no hormone
Ah.
in, and it is yeah, you can take that one, just use it during just before intercourse. That can be moisturize the area, but it's not permanent, not like the hormone cream.
Ah,
Yeah,
interesting. Okay.
yeah, yeah.
Okay. So this needs to be, well, in this part of the world, it needs to be prescribed,
Yes,
but
but maybe in the other part they can go to the pharmacy and they can have it.
yeah. Okay.
In England, quite a lot of rule and regulation, with everything.
Yeah.
But other country I have seen,
Mm-hmm.
they can go to the pharmacy and ask for it.
Okay.
Yeah.
Interesting. Interesting. Thank you for that. Really, really, I'm learning a lot as well, from
Yes,
all of
you.
this
Next
conversation.
thing you apply for Royal College of Obs and Guy, need to be a doctor.
I'm sure at this rate, I'll be considered.
Yes, yes,
Qualification.
yes, yes. You will be better than my registrar. Yeah,
Thank you, Miss Omar. Thank you.
you're
Um,
welcome.
there's another question. Someone's talking
Mm.
about why does forgetfulness occur during menopause? So kind of
Yeah,
forget.
yeah, that is the problem because as I told you,
Hmm.
it even it help for Alzheimer. The hormone lacking of hormone can process increase in the risk of Alzheimer and dementia,
Yeah.
and that is where it start. It start from forgetfulness and lack of concentration. So that is why we are promoting the HRT.
Right.
Yeah,
So the
yeah.
HRT helps to reduce that. Is that what you would
Yeah, of
say?
course. Yeah, and also reduce Alzheimer and dementia.
Mm, mm,
Mm,
wow.
mm.
Wow. That's really
Yeah,
amazing.
yeah,
Really, really
yeah,
interesting. Yeah.
yeah,
So something to look out for, something to watch out for, because I know that a lot of women, well,
yeah,
um, without telling my age, there's the people that I know in my age group who will say, "Oh, I forgot that," and literally,
yeah,
I
yeah,
would have to put things on my phone and notes, set up reminders about things. I can remember today and tomorrow be
yeah,
like
yeah,
something urgent, and I completely forget. So I tend to
yeah,
use
yeah. If you remember,
reminders.
I remember my mom was putting thing in certain place, and she was saying, "Oh, I put it in a safe place. Now I can't find it."
I
Yes.
know, I
So
know.
that
So,
is a lack of concentration and
mm,
forgetfulness. And I
mm,
didn't know at that time. I wasn't a doctor. When my mom was
wow.
telling me that, I wasn't really, but the menopause and HRT was not popular. Even as a student, I didn't have that much knowledge about it. So
Mm.
I remember I was giving her something and she was putting in a safe place. When I was asking for it, she was saying, "Oh, I don't know where I put it."
Mm, mm,
And
mm,
sometimes if we remember, we do the same thing now. We
mm-hmm,
do the same thing. You don't remember where you put that paper. So
mm.
this is
So, mm-hmm. Oh, we've lost Mr. Ma there. Mr. Ma, can you hear me?
yeah, yeah. I can hear you. I
Hello?
can. Yeah. Hello,
Okay.
hello. Yeah.
Are you back? Okay.
Don't
Okay.
worry. There is places
All
when I
right.
pass
So,
by. That is
I mean,
why.
it's interesting around this dementia and HRT. Well, I wanted to ask you a question. From experience,
Mm.
are there alternatives to HRT? Because especially in the area of maybe increased possibility of dementia because of the hormones. Are there other alternatives to HRT? Is there something else you can do if you don't
I,
want to take
as I
HRT?
as I said, there is no exactly replacement for it.
Right.
but the lifestyle and activity of the brain is very important. And the other thing, especially for moisture of the vagina, it is important that the woman to use those, if there is any moisturizer, especially is available in the other country, they can use it. But in reality, there is no 100%, even there is no 50% replacement for it.
Interesting.
There is no, yeah.
Interesting. Also,
No,
someone wants to know, can you approach the GP? So I'm assuming they're in this part of the world. So can you approach the GP for the HRT, or is it done privately? So can you just go to your GP and say, I want
no,
HRT?
you can go to the GP. I understand the GPs are sometimes they are a bit reluctant to put the woman through,
Right.
either because of the lack of knowledge or because of the expense.
Okay, wow. Okay,
Yeah, I believe they have to pay off some of them, or for 5 years they have to pay. I don't know how their system or their lack of knowledge, because I am in the system they call it Consultant Connect. Every day I do have 5-6 GPs calling for the question around the HRT and what to do with it.
Okay.
I think it is a lack of knowledge, because unfortunately the GPs, when they train in obstetric and gynecology, they train in the hospital. And HRT is not something you learn when you are in the clinic with a gynecologist. It's very different. It's a very subspecialty. So they have lack of knowledge, or they can't differentiate. So they question quite a lot. I've at least every day I have 4 or 5 phone calls, and they ask.
In my own opinion, probably it's more of the cost than anything, because those GP surgeries don't anything to put out. They try not to incur extra expense and
Cost is very important for them. Cost is very important. Cost is very important.
So any
And they
additional
love to come.
expense.
They love the women to come to the private. Then they will pay for their prescription because they are desperate. So they love that. They love them to go through that.
So the answer to that is most GPs are
Insist.
reluctant. So I guess
insist. Say I am sure they have to give.
So TalkSkill, maybe you want to first of all speak to your GP and see what he says, and if you're lucky for him to offer it to you, but if not, then obviously the other option is to go private. So
unfortunately that's why I give a lot of lectures to the GPs. I do a lot of lectures for menopause to the GPs, but of course it's a lot at how many GPs in this country. And certain GPs I have seen, they have a standard, which is they are very good. They know what they're doing. They have like a timetable, what to do with this lady, what to give. But certain GPs, they say, oh, I have no information, especially the men one. And they just close it on the woman. They can't do it. That's it. So but the women should insist and go for it.
Okay. So you've heard that TalkSkill. Please insist. And hopefully with a bit of push, you can
a bit of push, as you said, a bit of push. Hopefully they will. And it's not fair.
Amazing. Really, really.
It's not fair.
It's not.
No.
Especially if the woman needs it.
It is a life. Imagine, nearly 40 years of your life, you living with hormone, and then 30 years, 35 years without it is impossible. It is miserable.
Okay. Juliana thinks otherwise. She says GPs are different. Some are able to prescribe the HRT. So I mean,
Yeah,
hey, lucky you,
yeah,
Juliana. If
yeah.
you've got a GP surgery that's happy to give it out to you,
Mm.
that's
Yeah, some
awesome.
of them, they
That's
are
awesome.
clever. They are very clever. They know what they're doing, as I said. They have a timetable. They have like laminated. They know what they're doing, but some of them, they don't.
Okay, that's interesting. Another thing I want to touch a bit more about. I know you mentioned it
Mm,
earlier.
mm,
Around food, and because as African people we eat a lot of yam. So I need you
mm.
to kind of emphasize, and tell us a bit more about the nutritional value of
It's called
yam for
phyto.
women in menopause.
Yeah, it is very useful, and I believe some of the HRT also extracted from yam.
Oh wow, really?
Yeah, yeah, it is extracted from yam. So I mean, it is called phytoestrogen. So
Okay.
phytoestrogen, it is extracted from basically from the yam and from soya and also from some herbs, some vegetables. But they are less, from my experience, they are less susceptible for the symptom, especially if they live outside UK,
Okay.
because there they are more exposed. They eat in a more.
Mm-hmm.
But in UK, you have to go to special market for that, no?
Well, as an African person, we all know where we go to go get our yam. Mr. Ma,
Mm.
you're not African, you might not understand, but we know where to go. But I mean,
Yeah,
for just to make on a lighter note, honestly, I was thinking when you're talking about that, I was just thinking, well, when a woman hits menopause, you want to know that okay, yam is my main go-to. You
yeah,
want to have like
yeah,
yam twice a day.
yeah. Yes,
No, seriously, but
yeah.
just as a joke, it's
Mm,
good to know
mm,
that there's
mm.
something that it's got a lot of
Yeah,
hormonal benefit
estrogen.
that
Yeah,
one can
yeah,
go to and eat yam. You just eat that's right, Toski. We just eat yam every day
yeah. Just give
because
yam.
we
If,
have the
if they don't
benefit
like the
every day.
hormone, or if there is no hormone, then they can have just yam.
Yeah, so
Yeah,
we just eat yam all the time.
yeah.
We
Why
make it
not?
with
Why
different
not?
things, and
Why not?
that's really interesting, and that's very informative.
Mm.
Knowing
Yeah.
that eating yam makes a lot of difference at
Yes. Yeah.
menopause.
Yeah. But I don't know where you get it in England. Where you get it?
Miss
In
Omar, if
London,
you
no?
want some yam, I'll ship some over to you.
I have seen it in London, in Brixton. I've been in Brixton. I had some.
You don't have to go
Yeah.
that far. Don't worry. I
Uh,
can do you a bus and bring to your clinic.
thank you so much. Thank you.
It's
Yeah.
really been an amazing time. Thank you so much, Miss Omar, for your
You're
time. I know
welcome.
you're a busy
You're
woman,
welcome.
and I do
No
not take for
problem.
granted that you make time
No,
all the
no,
time
no.
to come
That's
and be with us and
no.
educate
It's
us and
absolute.
help support women. It's an amazing
Thank
thing.
you.
Thank
It's a
you. We
pleasure.
are
It's a
grateful.
pleasure.
We are
Thank
grateful.
you.
And I know
Have
that
a
we have
very
a part two. We have a part two of this, which is in
mm,
2 weeks, just to kind of
yeah.
talk more about anything that we've missed out or any question that women might still have that hasn't been answered in
No
this session.
problem.
So in two
No
weeks, we're
problem.
bringing Miss Omar back again. If you
Yes. Yeah.
have other questions, if there's something you still want to talk about regarding menopause, please let us know. And she's going to be back in 2 weeks to kind of continue this conversation because menopause is really an important topic, for women,
Mm,
and we need to be talking
mm.
about it. We need to be creating awareness. Like, I don't know about you, but I didn't know that eating yam will make a lot of difference. So now I know. So
You
it's
know
going to
now.
be
You know now. Make a
yam in
happy
my
life.
menu.
Happy
There you go.
family life. Happy man.
Say that again.
Happy wife. Happy life.
Happy wife, happy life. Absolutely. Absolutely. So thank you so much, Miss Uma.
You're
Absolutely
welcome. You're
for
welcome.
your time. So we'll be
Have
back
a
in
good
2 weeks.
evening. Thank
And
you.
back in 2 weeks.
Bye-bye.
Thank you so much. Thank you everyone for
Bye-bye.
joining.
Bye-bye.
Yes.
Bye-bye. Thank you.
See you in 2 weeks.
See you in two
Thank you
weeks.
everyone.
Bye-bye. Have a good night.
Have a
Bye-bye.
good night,
Bye-bye.
everyone. God bless
Bye-bye.
you. Bye
Bye-bye.
bye. Bye.
Bye-bye.
And you can follow us on Instagram, feminine health underscore fibroid support. And you can get this night's recording on there as well. And yes, let's help each other. Let's do this. Let's encourage one another and let's educate each other. Thank you, everyone. Have a good evening. Good night.